Every 40 seconds, someone in America has a stroke. Many could have been saved if they had just recognized the warning signs. I have spent over 3 decades working with seniors, and I have seen too many lives changed forever because warning signs were mistaken for just getting older. My team and I once worked with a wonderful lady named Margaret. She was 72 and thought her slurred words were just tiredness. 3 hours later, she was in the emergency room. The doctors said if she had come in sooner, the damage could have been much less. That moment taught us something powerful. Our bodies give us signals, but we must learn to listen. Research from the American Stroke Association shows that recognizing stroke symptoms within the first 3 hours can reduce long-term disability by 60%. These numbers are not just statistics. They represent fathers, mothers, friends, and neighbors whose lives could be saved. I want you to think about something. Have you ever felt sudden weakness and brushed it off? Have you noticed slurred speech in a loved one, but thought they were just tired? Have you experienced a brief moment of confusion and simply ignored it? These questions matter because your answers could save your life or the life of someone you love. Here is something many do not know. Strokes are not always dramatic, like in the movies. Sometimes they whisper before they shout. Sometimes the body sends small warnings days or even weeks before a major stroke hits. The challenge is that after 60, we often blame every ache and pain on age. We tell ourselves it is normal. But there is a difference between normal aging and a medical emergency. I am going to share something with you today that could change everything. 10 warning signs that your body might be crying for help. Some of these will surprise you. Some you might be experiencing right now. Stay with me until the end because the last sign is one that almost everyone ignores. Yet it is often the most important warning of all. If this information helps you or someone you care about, please subscribe to Healthy Life. We are here to keep you informed and healthy. Number 1. Sudden numbness in face or limbs. Imagine you are sitting in your favorite chair, reading the morning paper, and suddenly your hand feels strange. Not painful, just numb. Like it has fallen asleep, but you have not been lying on it. You shake it a bit, thinking it will pass. Maybe it does pass, and you forget about it. This is exactly how danger sneaks in. Sudden numbness, especially on one side of your body, is often the first alarm bell your brain is ringing. When blood flow to part of your brain gets blocked or reduced, that area cannot communicate properly with the rest of your body. The numbness might be in your face, your arm, your leg, or even just your fingertips. It might last a few seconds or a few minutes. Some people describe it as a tingling sensation, others as complete loss of feeling. The key word here is sudden. This is not the gradual numbness that comes from sitting too long or sleeping in an awkward position. The natural solution when you notice this is simple but urgent. Sit down immediately if you are standing. This prevents falls if the numbness gets worse. Try to move the affected area gently. If the numbness does not go away within a minute or two, or if it spreads, call for emergency help right away. Do not wait to see if it gets better. Do not drive yourself anywhere. The first 3 hours after stroke symptoms begin are called the golden window. Treatment during this time can prevent permanent damage and save your life. Understanding this symptom gives you power. It removes the fear of overreacting. Too many seniors worry about bothering doctors or family members. They think they are being dramatic. But when it comes to stroke, it is always better to be safe. Quick action means you might walk out of the hospital with minimal damage instead of needing months of rehabilitation. Your independence, your ability to hug your grandchildren, your chance to enjoy your retirement, all of these precious things depend on recognizing this single symptom and acting fast. Number 2. Slurred speech or confusion. Words are something we take for granted until they stop working properly. You know what you want to say, but it comes out wrong. Or you hear yourself speaking, but the words sound thick, like your tongue is too heavy. Sometimes you cannot find the right word at all. Your family member asks you a simple question, and you stare at them, confused, unable to form a response. Speech problems during a stroke happen because the language centers of your brain are not getting enough oxygen. There are different ways this shows up. You might slur your words like you have had too much to drink, even though you have not had a drop. You might use completely wrong words without realizing it. You might not be able to speak at all, even though you are trying. Or you might suddenly become confused about where you are, what day it is, or who the people around you are. This confusion is different from normal forgetfulness. It comes on suddenly and feels strange even to the person experiencing it. If you notice speech problems in yourself or someone else, here is what to do naturally and immediately. Ask the person to repeat a simple sentence like, "The sky is blue today." If they cannot do it, or if the words come out garbled, this is serious. Have them smile and check if one side of their face droops. These simple tests take 10 seconds, but can confirm that something is very wrong. The solution is clear. Call emergency services without delay. While waiting for help, keep the person calm and comfortable. Have them sit or lie down. Do not give them anything to eat or drink, because swallowing might be affected. The benefit of quick action here cannot be overstated. Speech therapy can help after a stroke, but preventing brain damage in the first place is far better. Every minute counts. Brain cells die quickly without oxygen. When you act fast, you give doctors the chance to use clot-busting medications that can stop the stroke in its tracks. You give yourself or your loved one the chance to continue having conversations, telling stories, and expressing love through words. These are not small things. These are the things that make life worth living. Number 3, blurred or double vision. Your eyes are windows to your brain, and when something goes wrong with your vision suddenly, your brain might be calling for help. You are watching television, and the picture starts to blur. You try to focus, but cannot. Or worse, you start seeing double. One person becomes two. One doorway becomes two. It is disorienting and frightening. Vision problems during a stroke occur because the parts of your brain that process what you see are being starved of blood. This is different from needing new glasses or having catchy eyes from tiredness. This comes on fast, within seconds or minutes. You might lose vision in one eye completely. You might lose peripheral vision, like looking through a tunnel. Some people describe it as a curtain dropping over part of their sight. The vision loss might affect one eye or both. It might be temporary, lasting only a few minutes, or it might persist. What should you do naturally when this happens? First, do not panic, though I know that is easier said than done. Close your eyes for a moment and then open them. If the problem persists, cover one eye and then the other to check if the issue is in one eye or both. Do not try to walk around much because your depth perception is compromised and you could fall. Sit down in a safe place. If the vision problem lasts more than a minute or comes with any other symptoms like numbness or headache, treat this as an emergency. Call for help immediately. Acting quickly on vision symptoms protects not just your sight, but your whole quality of life. Being able to see clearly means independence. It means you can drive, read, watch your grandchildren play, enjoy the sunset, and navigate your world safely. Stroke can steal all of that, but early treatment can preserve it. Your vision is precious. Do not gamble with it by waiting to see if symptoms improve on their own. Number 4. Dizziness or loss of balance. One moment you are steady on your feet. The next, the room is spinning. You reach for the wall, the counter, anything to hold on to. This is not the slight dizziness from standing up too fast. This is intense, overwhelming, and comes out of nowhere. Your balance disappears like someone has pulled the ground out from under you. When a stroke affects the cerebellum, the part of your brain that controls balance and coordination, dizziness and balance problems result. You might feel like you are on a boat in rough seas, even though you are standing still in your kitchen. Walking becomes difficult or impossible. You might veer to one side without meaning to. Some people experience vertigo, where everything seems to be spinning around them. Others just feel profoundly unsteady, like their legs do not work properly anymore. This can come with nausea or vomiting because your brain is receiving confusing signals about your body's position in space. The natural response when you feel this way is crucial. Sit or lie down right away. Falling is a serious risk and can cause additional injuries that complicate everything. If you are alone, try to get to the floor carefully or sit in a sturdy chair. Do not attempt to walk to another room or go downstairs. Stay where you are and call for help. If someone is with you, have them stay close in case you start to fall. Keep your head still, because moving it might make the dizziness worse. If this severe dizziness lasts more than a few minutes or comes with other symptoms, this is an emergency situation. The benefit of taking dizziness seriously is that you protect yourself from both the stroke and from dangerous falls. Many seniors break hips or hit their heads when they fall during a stroke. These secondary injuries can be just as dangerous as the stroke itself. By sitting down immediately and calling for help, you give yourself the best chance of treatment and recovery. You also maintain your independence, because preventing severe strokes means you can continue living the active life you enjoy. Balance is something we need every single day, for every activity. Protecting it is protecting your freedom. Number 5. Severe headache. Without cause. A headache that strikes like lightning, sudden and severe, unlike any headache you have had before. There is no warning, no gradual buildup. 1 second you are fine, the next you are in the worst pain of your life. This is not a tension headache or a sinus headache. This is something different, something terrifying. This type of headache, especially when it accompanies a stroke, is often caused by bleeding in the brain rather than a blocked artery. Doctors call this a hemorrhagic stroke. The pain can be so intense that some people describe it as being struck by lightning or having their head explode. It might come with vomiting, stiffness in the neck, or sensitivity to light. Some people lose consciousness. The sudden, severe nature of this headache is what sets it apart. Regular headaches build over time. This one arrives instantly and is often the worst pain you have ever felt. When you experience a headache this severe, there is only one natural solution, and that is immediate emergency care. Do not try to treat this with over-the-counter pain medication. Do not lie down and hope it passes. This is your brain telling you that something catastrophic might be happening. Call emergency services right away. While waiting for help, try to stay calm and still. If you vomit, turn your head to the side to prevent choking. If you are with someone having this symptom, keep them comfortable and awake if possible. Note the exact time the headache started, because this information helps doctors determine the best treatment. Hemorrhagic strokes can be fatal, but fast treatment dramatically improves survival rates. Doctors can sometimes stop the bleeding, reduce pressure on the brain, and prevent permanent damage. Every minute matters even more with this type of stroke. Your quick action, your willingness to take severe pain seriously, could be the difference between life and death. It could mean the difference between recovering fully and living with severe disabilities. Never ignore a sudden, severe headache. Your life might depend on getting help fast. Number 6. Trouble walking or coordination. You stand up to walk to the kitchen and your legs do not work right. Your feet feel clumsy, like you have forgotten how to walk. You stumble, not because you tripped over something, but because your body is not responding the way it should. Your coordination is off. Reaching for a cup, you knock it over instead. Simple movements become difficult or impossible. These coordination and walking problems happen when stroke affects the areas of your brain that control movement and spatial awareness. Your brain can no longer send clear signals to your muscles about how to move. One leg might drag or feel weak. Your steps might be uneven or wobbly. You might feel like your body does not belong to you anymore. Some people describe it as feeling drunk or disconnected from their limbs. The scary part is that this can happen even if you have no pain. Your body simply stops obeying your commands. The natural approach when this happens is to stop moving immediately. Find something stable to hold on to or sit down right away. Do not try to prove to yourself that you can still walk normally. Pride has no place in a medical emergency. If you are alone and having trouble walking, crawl or scoot to reach a phone if you need to. Do not stand and risk falling. If someone is with you, let them support you or help you sit. Call for emergency help if the coordination problems persist for more than a minute or two. Even if they seem to improve, you should still seek medical attention because this could be a warning of a bigger stroke coming. Understanding and acting on this symptom protects your mobility and independence. Being able to walk, to move freely, to take care of yourself. These are fundamental to quality of life, especially as we age. Stroke can take away your ability to walk to the bathroom alone, to get dressed by yourself, to go outside and feel the sun. But if caught early, if treated quickly, you have a much better chance of keeping your mobility. You have a chance to continue living independently, to keep doing the things you love. That is worth calling for help, even if you feel embarrassed or uncertain. Your ability to move freely is too precious to risk losing. Number 7. Sudden fatigue or weakness. Exhaustion crashes over you like a wave. Not the tiredness from a busy day or a poor night's sleep. This is different. Overwhelming weakness that makes it hard to keep your eyes open or lift your arms. Your whole body feels heavy, like you are moving through thick mud. You might feel like you need to lie down right now, this instant, because you cannot stay upright anymore. This sudden, extreme fatigue happens when your brain is not getting enough oxygen and blood. Your brain uses about 20% of your body's energy, so when it is in distress, your whole system feels it. The weakness might be all over, or might concentrate on one side of your body. Your arm might feel too heavy to lift. Your leg might not support your weight. Even sitting up might feel like too much effort. This is not normal tiredness. This is your body shutting down because your brain is in crisis. Some people also experience a general feeling of being unwell, an instinct that something is very wrong even if they cannot pinpoint exactly what it is. Listen to your body and rest immediately. Lie down if you can do so safely. Do not fight through this fatigue thinking you just need to push yourself. Do not wait to see if it improves after a nap. If this weakness comes on suddenly and is severe, call for help right away. Have your phone nearby before you lie down. If you live alone, consider keeping a medical alert device or making sure family members can reach you easily. Even if you feel too tired to make a phone call, you must try. This exhaustion could be a sign that your brain is dying, cell by cell, while you rest. The benefit of recognizing extreme fatigue as a warning sign is that it might be the only symptom you notice. Some strokes are subtle. They do not announce themselves with dramatic paralysis or loss of speech. They creep in quietly with overwhelming tiredness. By knowing that sudden, severe fatigue can be a stroke symptom, you give yourself the knowledge to act. You protect your brain, your future, and your ability to continue living an active, engaged life. Do not dismiss extreme weakness as just a bad day. It could be your body's loudest cry for help. Number 8. Difficulty swallowing. You take a sip of water, and it goes down wrong. You cough, choke, feel like the liquid went into your lungs instead of your stomach. Or you try to swallow your food and cannot. It feels stuck. Or you have lost the automatic ability to swallow that you have had your whole life. This is frightening because swallowing is something we do without thinking, thousands of times a day. Difficulty swallowing during a stroke, which doctors call dysphagia, happens when the stroke affects the nerves that control your throat muscles. Swallowing is actually a complex process involving many muscles and nerves working together perfectly. When a stroke disrupts this coordination, food and liquid can go into your airway instead of your esophagus. This causes choking and coughing. Some people cannot swallow at all. Others can swallow, but it feels wrong, difficult, or painful. You might drool without meaning to because you cannot swallow your saliva. This symptom is particularly dangerous because if food or liquid gets into your lungs, it can cause pneumonia on top of the stroke. If you notice sudden difficulty swallowing, stop eating and drinking immediately. This is the most important natural response. Do not try to finish your meal or force down that glass of water. Sit upright and try to cough out anything that might be in your throat. If you are choking, get help right away. If you can breathe but swallowing feels wrong, this is still an emergency. Call for medical help even if you are not actively choking. Difficulty swallowing combined with any other symptom on this list almost certainly means stroke. Even by itself, if it comes on suddenly, it deserves immediate medical attention. The benefit of recognizing swallowing problems as serious is both immediate and long-term. Immediately, you protect yourself from choking or aspiration pneumonia. Long-term, you ensure that doctors can address the stroke quickly, giving you a better chance of recovering your ability to swallow normally. Being able to eat and drink safely is fundamental to life and pleasure. Sharing meals with loved ones, enjoying your favorite foods, these are joys you do not want to lose. Quick action on swallowing symptoms helps protect these simple but profound pleasures. Number 9. One-sided paralysis. Half of your body stops working. Your left arm hangs useless at your side. Your right leg will not move, no matter how hard you try. One side of your face droops like melted wax. This is one of the most recognizable stroke symptoms, yet many people still delay getting help, hoping it will pass or thinking it cannot be that serious. One-sided paralysis, called hemiplegia, happens when stroke damages the part of your brain that controls movement on the opposite side of your body. The left side of your brain controls your right side and vice versa. The paralysis might be complete, meaning you cannot move those limbs at all. Or it might be weakness where the limbs move but without normal strength or control. Your face might droop on one side, so when you smile, only half your mouth moves. An eye might not close properly. Speech often accompanies this because the same side of your brain that controls face and arm movement often controls speech. The natural and only appropriate response to sudden one-sided weakness or paralysis is immediate emergency care. There is no home remedy for this. There is no waiting to see if it improves. Call emergency services the moment you notice it. Use the FAST test that emergency workers teach. Face, ask the person to smile and check if one side droops. Arms, ask them to raise both arms and see if one drifts downward. Speech, ask them to repeat a simple sentence and listen for slurring. Time, if any of these signs are present, time to call emergency services immediately. While waiting for help, note the time symptoms started. Keep the person calm and lying down with their head slightly elevated. This symptom means a significant part of your brain is not getting blood. Brain cells die quickly, within minutes, but treatments exist that can restore blood flow if given in time. You might recover completely. You might regain the ability to hug with both arms, walk without a cane, smile with your whole face. Or you might face months of difficult rehabilitation. The difference often comes down to how fast you acted. Do not let pride, fear, or uncertainty delay you. One-sided paralysis is a medical emergency. Full stop. Number 10. Mini-stroke signs that vanish quickly. This is the warning most people ignore, and that ignorance can be deadly. You experience numbness, confusion, vision problems, or weakness, but then it disappears. 5 minutes later, you feel completely normal, so you tell yourself it was nothing. You convince yourself you overreacted, that you were just tired or stressed. This is the most dangerous mistake you can make. What you experienced was likely a transient ischemic attack, called a TIA or mini-stroke. This happens when blood flow to part of your brain is temporarily blocked, but then restores itself. The symptoms are identical to stroke symptoms, but they resolve on their own, usually within minutes, sometimes within an hour. Your brain was briefly starved of oxygen, but recovered before permanent damage occurred. Here is what makes this terrifying. A TIA is a warning. It is your brain's way of telling you that a major stroke is coming. Research shows that about 1 in 3 people who have a TIA will have a full stroke within a year. Many of those strokes happen within days or even hours of the TIA. The natural response to a TIA should be the same as to a stroke, immediate medical attention. But most people do not seek help because the symptoms went away. They feel foolish going to the hospital for something that already resolved. This thinking can cost you your life or your independence. Even if your symptoms have completely disappeared, call for medical help. Tell them you think you had a TIA. Doctors can run tests to find out why it happened, discover blocked arteries, irregular heart rhythms, or other problems that can be treated to prevent a major stroke. Treatment might include medications to prevent blood clots, procedures to clear blocked arteries, or lifestyle changes to reduce risk. The benefit of taking a TIA seriously is that you get a second chance. Not many people get a warning before a major health crisis, but a TIA is exactly that, a warning. It is a gift, though it does not feel like one. By seeking immediate medical care after a TIA, you can prevent the major stroke that would otherwise be coming. You can protect your brain, your independence, and your future. You can continue to be yourself, whole and healthy, instead of struggling through rehabilitation or living with permanent disabilities. Do not ignore this final warning. Your brain is speaking to you. Listen before it is too late. Sudden numbness in your face or limbs, slurred speech or confusion, blurred or double vision, dizziness or loss of balance, severe headache without cause, trouble walking or coordination, sudden fatigue or weakness, difficulty swallowing, one-sided paralysis, and those mini-stroke signs that vanish quickly but carry enormous danger. Each of these symptoms deserves immediate attention. Together, they give you the power to recognize when your brain is in crisis. The long-term benefit of this knowledge is simple but profound. You can save your life. You can save the life of someone you love. You can protect your independence, your ability to think clearly, move freely, and enjoy your remaining years to their fullest. By acting quickly, by refusing to ignore warning signs, by choosing to seek help even when you feel uncertain, you give yourself the gift of time. Time for treatment. Time for recovery. Time for life. May good health and long life be granted to all of us. May we have the wisdom to listen to our bodies and the courage to act when something feels wrong. If this video has resonated with you, if you have experienced any of these symptoms or know someone who has, please share your story in the comments below. Your experience might help another person recognize their own warning signs. If you have questions about your health or want us to create content on a specific topic, let us know in the comments, and we will do our best to help. Like this video, share it with friends and family who need to hear this information, and subscribe to Healthy Life so you can continue learning how to protect your health and live your best life at any age. Before I close, I must mention this. If you have existing health conditions like heart disease, high blood pressure, diabetes, or if you take blood-thinning medications, talk with your doctor about your stroke risk and what specific symptoms you should watch for. If you have had a stroke or TIA in the past, work closely with your healthcare team to prevent another one. Do not try to diagnose or treat stroke symptoms yourself. Always seek emergency medical care if you experience any of the warning signs we discussed today. Your doctor and emergency medical professionals are your partners in staying healthy and safe. Thank you for spending this time with me today. Stay alert, stay informed, and take care of yourself and those you love.